Rachel Casilla here to perform a head-to-toe assessment on a patient that's a male, approximately 18 years of age. No identification will be present. Normally, assessments are done with patients in a gown with no clothing. My hands have been washed, and we'll just do a normal wellness exam. To begin with, we will look at the head, inspecting the head, looking for skin color, which is pink and normal. No lesions are present. No rashes are present. Looking at skull, making sure that it's round and it is symmetrical. Palpating this head, looking at hair distribution and quantity, checking there is no dandruff, no psoriasis, and no rashes present. And distribution is appropriate. Next, moving on to the face, we will palpate the facial bones, inspecting the facial, looking for any kind of signs of swelling, redness, bruising, or anything abnormal, which I do not see. Next thing will be happening is palpation of the facial bones, looking for any kind of crepitus, swelling, pain. Is any of that happening?
No.
Okay. Next, we will check the temporomandible joint. We will ask the patient to go ahead and open, close. Any pain?
Mm-hmm.
And no clicking was noted. Next, we will check the patient's oral. So we will ask to open the mouth. The tongue is pink and moist. We will check cheeks, moist. Patient does have 32 teeth, which are white, no cracks. Checking gums, they're pink, no signs of infection. And then open and say ah. Uvula is midline, tonsils are present, no swelling noted, and no exudate in the back of the oropharynx. Next, we will move to inspecting the patient's eyes. Our eyebrows are symmetrical, full. Patient can open and close eyes appropriately, and eyelashes are intact. We will go ahead and pull down on the lower lids, inspecting the conjunctivi, which are pink and moist. Palpating. And no exudate is noted. Also just looking, irises are brown bilaterally. And next we will palpate the sinuses, looking for any kind of pain upon palpation. Anything?
No.
Sclera was white. Conjunctivi was pink and moist, which would complete that. Next, we will go ahead and look at the cranial nerve number 2 with a Rosenbaum test. It is a vision test the patient will hold in his hand. It's looking for assessment of vision screening. I'll ask you to read this lower line as possible.
PQDTVC.
Good. Next, I will inspect the patient's pupils. I'm looking for round, reacting to light and accommodation. Normally you would dim the lights, however we can't do this for this assessment, so I'll cover. Pupil is round, reactive to light, and accommodates. Vision fields will be tested next, and we will do the cover uncover test. So I will ask you to cover your right eye first and uncover. And then take the left, uncover. Good. And we will test visual or extraocular motions. I'm gonna ask you to keep your head straight, only using your eyes, and follow my finger. That is testing cranial nerves 3, 4, and 6. And then the next test we will perform is going ahead and looking straight, keeping your eyes right here at my nose. I'm going to raise my hands. We're doing visual fields. Whenever you see the number pop up, I want you to say it.
2, 3, 3, 1.
All visual fields are normal and present at this time. Ears, we're looking for outer appearance, making sure that they're symmetrical and in line with the eyes. They're pink, looking at the auricle, the pinnae, the tragus, making sure that there's no exudate, no lesions, and palpating for any kind of pain. Okay. Next thing we will do is a whisper test. We will do this bilaterally. We'll have the patient cover his ear.
Rebels roll.
And patient was able to state what he heard. That is the cranial nerve 8 that we just assessed. Next thing is the structure of the nose. We're looking for the color, any kind of deviation, which is not present. It is straight, it is midline. It's aligned with his eyes and his mouth. We will look for patency. We'll ask the patient to close one nostril and breathe in and out. And that will happen on the other side as well. Good. We'll look inside of the nostril. And turbinates are clear or pink, moist, no lesions are present, and no excessive exudate is there. One more thing, lips are pink, symmetrical, no cracking, and no dryness are present. Did we do the eye test? We did. Next, we'll move on to his neck. We will be looking for inspecting for just the normal structures, any kind of deviations. We will look to make sure that there's no swelling, there's no redness, no bruising, and no abnormalities. Next thing that can occur is to assess the trachea, which you want it to be midline. While you're here, you can go ahead and find the patient. Can you turn a little bit? Keeping the patient draped, turn. You can find the thyroid right underneath here. You'll place your hands on the thyroid membrane. Ask the patient to swallow. Good, and swallow. Assessment of carotid pulse should be taking place on both sides. Listening with the bell for any kind of buoys bilaterally. Palpating the neck and the lymph nodes, starting in the occipital area, pre-auricle, post-auricle, mandible area, cervical, deep cervical, subclavicular, and infraclavicular. Assessment of the neck needs to occur. Go ahead and push on my hand for me. Good. And flex down and extend up and turn side to side. Next, we'll lay the patient down in a supine position, checking for jugular vein distension, which is not present. We'll ask the patient to turn a little bit to the left, noticing the external jugular vein. It is pulsating with the internal jugular vein. We'll check for venous pressure on the right side. Keep your heads up. Looking for the highest point of pulsation at this point in connection with the sternum. Which is approximately 2 centimeters. At this point, you can listen to an apical pulse while you check the carotid. As you feel the upward stroke, it should be right after the S1. Come up a little bit. Right. Next, we will inspect and assess the anterior lungs. So I would be looking for respirations. I would look for accessory muscles, intercostal movement, the rate, the depth, and the color of the skin. Also the chest, and if it's symmetrical, rising. Palpation can occur, just looking for any kind of crepitus, movement. Percussion should be having a resonance until you get to the lower edge where the liver should be present, and dullness will occur over the cardiac region. Next thing we can do is ask the patient to say 99.
99.
Looking for firmness.
99.
And on the laterals.
99.
Auscultation can occur in all 8 regions. You would ask the patient to breathe in and out. Next assessment is on the posterior chest. Let me just push it a little. Looking and inspecting, looking for shoulders are symmetrical, looking for scapula, they're symmetrical. Looking for at the skin for any kind of bruising, paleness, lesions which are not present. Palpating the spine for any kind of pain, making sure everything is in alignment. Percussion percussion bilaterally. Also, diaphragmatic excursion can occur, and as you're percussing down, once you hit the first area of dullness, you would mark with your pen. Go ahead and take a deep breath in and hold. And breathe. Take a few deep breaths. This will be repeated all the way down for your next second measurement. Take a deep breath in. And breathe. Breathing. Measurement from one point to the next would occur, and we're right at 4 centimeters, which is appropriate on the diaphragmatic excursion exam. Auscultation of the lung fields, posterior needs to be, it would be systematic, bilaterally, all the way down, and in the lateral aspects. And you can sit back. So cardiac assessment is next, and so you would want to open the chest, and I would be looking for any kind of thrills or looking for heaves or pulsations that are present. Next, I would be feeling, checking the precordium for thrills or heaves, and just locating the apical pulse. Auscultating the heart sounds, so aortic, pulmonic, secondary pulmonic, mitral, and tricuspid. While you're in this position, you can ask the patient to raise his arm, put it down, and a breast exam would be occurring on bare skin. You would inspect the skin and the nipple for any kind of discharge, any kind of swelling, redness, pain, and some abnormalities that are not symmetrical. At that point, you can palpate the axillary lymph nodes, and so you would start, looking for any swollen or enlarged lymph nodes. While the patient's in this position, the next assessment is on the abdomen. You would lay the patient back supine. Extend the legs. Color, looking at the patient's abdomen and assessing the color, making sure that it's not jaundice, making description of is it distended, is it round, is it flat. I would also look for any kind of movements along the abdomen wall, and also taking note of any kind of pulsations that might be occurring. Next thing after inspection is to auscultate and not palpate. You will auscultate all 4 regions, listening for any clicks or gurgles. If nothing is heard in 5 minutes, then we can record absent bowel sounds. After auscultation, we will lightly palpate the patient's abdomen, making sure that they are relaxed. Deeper palpation or percussion can occur, starting on the right side, on the lower portion, keeping in mind that the liver will be coming up on the right upper quad in the mid-axillary line. So we should expect some dullness at some point, especially right under the edge. On the left side, percussing all areas. For resonance, dullness may occur on the left upper quad where the spleen is located. Palpation, so we'll become a little bit deeper. Palpating kidneys bilaterally. On the right side, making sure that you can find the diaphragm and trying to observe and feel for the liver, which we should not feel on a normal patient. On the left side, doing the same exam and trying to palpate the spleen. Again, checking for aortic pulsations, auscultating the aortic, the renals bilaterally, the iliac, and the femorals bilaterally. While you're in this position, you can check the hips for stability. Keeping the patient draped, take the cover off. You will check and assess range of motion of the hips. Go ahead and lift the leg all the way up. This will be done bilaterally.
Like this.
One leg,
Oh.
straight. And bend your knee. And swing the leg out. And leg in. Any pain? This will be done bilaterally on both legs to check both hips. While the patient's uncovered, it is a good time to look at the legs, inspecting for color, lesions, abnormalities, making sure both legs are symmetrical, looking for any edema that's present. And then recovering the patient and having him sit back up. Watching his appropriate movements. While you're here, you can check the arms. This will be done bilaterally. You'll be looking first for, can you flex your elbow, straighten, bring out, go up, come all the way down. You'll assess and inspect the color of the skin. Is it pink? Is there any abnormalities? Is there any swelling? You'll check the radial pulse as well as the brachial. Check your hands. This. Keep your hands straight. Make sure that I can't close them. And it is appropriate strength and wrist and fingers. Good. Shoulder, elbows. Okay. So after the legs, we've inspected the legs. When the patient was laying down, we will go to palpating them, checking the temperature, the texture, any dryness, any rashes, any swelling, any edema. Checking pedal pulses and radial pulses bilaterally and checking for comparison on those pulses. Asking the patient to bend your knee up and straight and rotate your ankles inwards and outwards and toes. Push this down. Next is the neurological exam. We'll check sensation. I'd like like for you to close your eyes, and tell me if you feel dull or if you feel sharp.
Dull. Sharp. Dull. Dull. Sharp.
And also on the patient's back. What do you feel?
Sharp.
And
Sharp.
close your eyes.
Dull.
So close your eyes and tell me if I'm touching you once with one object or two objects.
One.
Good.
One. Two.
We'll do a thigh test, keep your eyes closed. Same thing, one or two.
One.
And on your back. One or two.
Two. One.
Next test is a stereogenesis test. You're gonna try to identify objects that are placed in your hand with your eyes closed. These are common objects.
Coin. Key.
The patient was able to describe them. In the next test, you're gonna close your eyes. It's called a Graphothesius test. I'm going to write something in your palm and you're gonna tell me what it is.
A.
The next one.
Two.
And open your eyes. So next test is an upper fine motor test. We are gonna ask you to do some things like close your eyes and touch your finger to your nose back and forth. Good. Open your eyes. Next thing is you're gonna take your finger, touch your nose, and touch my finger. And next thing you're gonna do is take your thumb and touch each one of your fingers on both hands. Lower extremities will be assessed. You'll take your heel to your knee, down to your ankle, and just rub it. And then the next thing I'd like for you to do is to take your knee, cross over both. I'd like for you to close your eyes. I'm gonna move your fingers up or down, and I need you to tell me which way I'm going. This is just a position sense test.
Up. Down. Up. Down.
Deep tendon reflexes I'm going to assess. So bicep, relax. Tricep, brachioradial, relax. Patella, relax. And the Achilles was assessed as well. Plantar reflex needs to be assessed on the foot. Relax. Patient's toes move downwards, which is a normal sign. We are going to ask you to stand up. I'm gonna assess your spine. Looking, it is symmetrical at this point. Making sure he has no pain anywhere. Bend over. Checking for alignment. Okay, stand up. We will assess your range of motion at this point. So that was flexion. So we would ask you to extend all the way back as much as you can. Good. And twist on each way. And bend laterally. Stand here. We're going to check your sense of balance in your cerebellum with proprioception. So close your eyes, hands by your side, and there is no swaying. Open your eyes. We will ask you to walk to the wall and back, checking for his gait, which is normal. And then turn around. I'll ask you to go back, heel to toe, to the wall. Okay. Stand on one foot with your eyes closed. Okay, and then stand on, this will be done for 30 seconds. And the other foot for 30 seconds. And open your eyes. And hop in on one foot in place, please. And you can have a seat. It concludes the assessment. Findings were normal, and a wellness exam is complete. Thank you for being the patient.
Thank you.